I wanted to give you a brief update around where we are at the moment in response to COVID, but also to tell you a bit about the national guidance that has recently been published. So at the moment, I'm very pleased to say that the level of COVID positive patients across both our hospital sites remains low. So for the past month, we've had on every single day, we've had fewer than 5 COVID positive patients across both of our hospital sites. And the prevalence level in our communities is actually also low as well. Obviously, we do still have to make sure we're doing all the things that we should be around face masks, hand washing, social distancing. But now really is the time where we need to start picking up those non-COVID services and try and get them to the same levels that they were pre-COVID. Last week, the national team overseeing the NHS sent all organisations a letter that sets out the key priorities moving forward and looking to address the next phase of COVID. So the 3 main priorities are the return of more non-COVID services, preparations for winter, and making sure that we've learned the lessons from the first wave of the pandemic. In terms of the non-COVID services, there's an expectation that by October, we're up to 90% of the activity that we delivered this time last year for elective care, for outpatient and day case procedures. So that's a really big ask, getting to 90% of where we were a year ago. And for endoscopy, MRI and CT, getting to the same level of activity that we had this time last year. So we've got lots of plans around how we're going to deliver that. It is an ambitious ask, but we know it's absolutely the right thing we should be aiming for to make sure we're doing the best that we can for our local communities. The second ask is around making sure we have a really robust plan to tackle the challenges ahead in terms of winter and the possibility of a second spike of COVID. So we're doing lots of work with our partners, but also within our organisation to try and make sure we're as best prepared as we possibly can be, and that the whole system is pulling together and knows what to do if certain situations arise. Part of that is a real expectation that we do better than we did before around making sure that all of our staff have a flu vaccination, because the idea of having winter pressures and then COVID and then flu on top of that, it could really be the perfect storm. So we're very keen to make sure that everyone receives the flu vaccination. The third priority is making sure that we have learnt the lessons from the pandemic. So all the stuff we've been doing around staff support, listening to what has made a difference to you over the past few months, making sure that we carry on those things, make sure that we are offering the right support around psychological support, and doing all the things that we've talked about around risk assessment. So we're really making sure that we're supporting all of our colleagues should a second wave happen. The other area that we are looking at is around the issue of inequality. And it's been widely reported that COVID has actually exacerbated many of the inequalities that existed before the pandemic. So we are going to be doing some work with our local communities and local authorities to really try and understand who it's hit the hardest in terms of our patient groups, and to think through, are there certain things that we could put in place to make sure that people who haven't been accessing services, who've had very poor outcomes, that we could try and learn those lessons and make sure that people can come back, and that we're able to try and make sure that people get broadly similar outcomes regardless of their backgrounds or their ethnicity. I wanted to say a massive thank you again for the incredible work that everyone's done over the past few months. Without it, there's absolutely no way we would have been able to get through this pandemic in the way that we have, and to make sure that we haven't been overwhelmed. There's an awful lot more work to do. As you know, we are concerned about the level of harm on our waiting lists at the moment, particularly people who possibly might have cancer but don't know about it yet. So there's lots and lots of work we need to do to try and resume our services so that we can make sure we're identifying people who need treatment and then delivering it in as timely a way as possible. I also just wanted to say, please do make sure you're taking time off. I know it's always busy, but it's really, really important that people are taking their annual leave, that you do have an opportunity to recharge your batteries, because we do know that the winter that's ahead is likely to be a very challenging one. And it's really, really important that people are coming into the kind of months of November, December, January fully recharged after the months that we've had. So massive thank you again, and look forward to seeing you round and about.